So if I said there was a tiny little tablet you could take every day that improved your testosterone to estrogen ratio, helped with recovery from training, helped look after your heart, brain and prostate health, it would sound like hype. It's not. Tadalafil, which yes is the drug you typically think of in terms of helping with erectile dysfunction, it does all these things. So primarily in this kind of TRT world, the reason we like Tadalafil is modulating estrogen. Particularly in leaner guys, it's really effective at doing this. Now, if you look at the research, it's about an 18% reduction, but what we see in practice is it's really individual. Some guys, it's a subtle effect it has, which is great. Some guys actually does a really more profound job of modulating estrogen, so it's a really useful tool, particularly if you're looking to, for whatever reason, avoid the use of classic aromatase inhibitors. How does Tadalafil modulate estrogen in these leaner guys? Well, it's probably acting on the aromatase enzyme itself, which is what converts testosterone into estrogen, but it's also likely having an effect on the estrogen receptor activity as well. So one of the really exciting areas with Tadalafil is the effect it has on cardiovascular health and longevity. So there was a really good study on 1.6 million men back in 2024. They were all taking 5 milligrams of Tadalafil daily, and they had a 30 to 50% reduction in things like stroke and heart attack, all these kind of cardiovascular related illnesses, which is huge for like a little tablet you can take every day. So in terms of how it has these effects on the cardiovascular system, it's something that's still being looked at, but essentially what it's doing is the plumbing for all your kind of heart and your blood vessels. It's helping vasodilate or widen that area. It's doing a little bit more than that as well. It's helping look after the health of the endothelial cells. These are just specialized cells that line all that plumbing. And that's kind of the basis of what we're talking about with all these other health benefits of Tadalafil as well. So in terms of cardiovascular benefit, it works by acting on these PDE5 receptors and CGMP as well. So it's all basically about endothelial lining, the kind of specialized cells that line the plumbing of all your kind of blood vessels and your heart and everything like that. This is what reduces the risk of stroke and heart attack with this little pill that you can take every day.
Should all, like, everyday people be taking that?
So there's an argument for it. I mean, to be honest with you, obviously you need to go through a little bit of regulation with it. I'd shove it in the water supply if I could, because there's not really a downside to it. There's a few side effects that can come up, mostly transiently at the beginning when you start taking it, which are fairly easy to mitigate. So the most common one probably is a little bit of a headache if you're very dehydrated. So the obvious solution to that is drink more water, which we probably all need to do anyway. When you first start taking Tadalafil, you can get a bit of reflux, especially if you take it on an empty stomach. So the advice usually is take it with food. The other thing you can do is just take half a dose. So typically you start on a 5 milligram dose daily, but you could half that to 2.5 whilst you're kind of gradually getting used to it and building it up. Similarly, a bit of lower back pain, occasionally you can get that. That's a hydration thing as well. And all these things I'm talking about, first 2 to 4 weeks maybe, and then if you address those things, even if you don't address them, sometimes they tend to just go transiently. Another really big advantage that I think is equally exciting to all the kind of heart benefits you get with Tadalafil is the cognitive performance as well. Similar kind of thing, that it's helping with blood flow to areas. So the brain being one of them, you need really good perfusion or blood flow to the brain for it to operate properly. So another, again, a really good study they did was over a couple of weeks, giving 5 milligrams of Tadalafil to some guys, and they did these quantitative tests on things like memory, and consistently these guys improved relative to the control group that weren't taking it. The really, really exciting area is that they're starting to look at Tadalafil in use of preventing things like dementia and Alzheimer's, which is really exciting. Another really good one is improving your kind of response to specifically resistance training. So there's some great research looking at using Tadalafil, again a 5 milligram dose, in your meal before resistance training. And what we're seeing is, although it's subtle, a notable improvement in how well the body's repairing and recovering from those sessions. Again, most likely a blood flow element to those muscles, but also there's some theories on Tadalafil actually directly acting on androgen receptors and upregulating those. So yeah, some profound effects Tadalafil can have outside of just better erections. So we've obviously got a huge age range of patients that we look after. the older population, so the prostate naturally gets a little bit bigger as we get older. It can get to the size where it's causing some issues passing urine. It's essentially a massive tissue that's right up against the plumbing of the urinary tract, so it can cause some issues trying to pass urine. Tadalafil is great for that as well. It's approved for use of that. You would see that being used in the NHS as well. It basically relaxes all the smooth muscle and helps with those lower urinary tract symptoms. So if you're peeing frequently because of your prostate, or having that kind of interrupted flow of urine, that's going to help. That's something that does help with it as well. One area that I personally really like about Tadalafil is that it helps with muscle protein synthesis. Specifically if you take it in the meal before resistance training. So the studies done on this showed a quantifiable improvement in lean mass with guys that did take a 5 mg dose in that meal beforehand. How's it doing this? Probably with blood flow, an element of increased blood flow to the muscles, but it also acts potentially on androgen receptors directly upregulating those as well. We know that it improves insulin sensitivity as well, which is becoming increasingly a kind of hot topic in all these areas of longevity. And we know that it also reduces inflammation, so things that you can actually measure like TNF-alpha or CRP, so blood measurements of inflammation, we see those reduce with use of Tadalafil as well. Yeah, so really exciting stuff.
He's a natural.
Is that right?
Yeah. Spot on. Cheers, mate.
Almost sounded like I knew what I was talking about.